You know that private moment? When the door's closed, the world's quiet, and you're alone with yourself. If you're an older man who still finds comfort, release, or even just a familiar habit in masturbation, I need you to hear this. Really hear it. Because there's something almost no one tells you, a quiet truth that might be chipping away at your strength, your sensitivity, even your confidence. It's not that you're doing it. It's how you're doing it. Before we get started, if you haven't subscribed yet, please tap that button and turn on the bell. Why? Because we create vital health insights specifically for men in their 60s, 70s, and beyond, information most doctors just don't share. Subscribing means you never miss these crucial updates. And if this speaks to you, type 1 in the comments below. If it doesn't, type 0. Your feedback helps me create content that truly serves you. Now, let's uncover the truth your body's been whispering. My name is Dr. David Lee. For the past 3 decades, I've dedicated my practice to helping men over 60 reclaim their energy, their intimacy, and their core strength. Week after week, men walk into my clinic carrying quiet concerns, and I can tell you this, one of the most common, yet least understood, issues I see revolves around this very private act. Most men believe masturbation is either purely good or purely bad, black or white. But the reality? It's far more complex and far more important than you might think. While self-pleasure can support your health, it can also, slowly and silently, chip away at your performance, your hormone balance, your circulation, and even your deepest connections to others if it's done the wrong way. Today, we're going to walk through the 10 hidden risks of masturbation after 60 that most doctors never explain. Risks that go far beyond simple morality. And crucially, I'll show you how to transform this private habit from a potential drain into a powerful tool, one that can protect your prostate, improve vital blood flow, strengthen natural testosterone levels, and actually enhance real-world intimacy. And before we finish, I'll share the simple, natural 7-second technique I give my patients to help restore firmness and drive, safely, powerfully, and without a single prescription. Let's begin, because your health, your confidence, and your vitality deserve the full truth. The danger starts deeper than you think. Most discussions jump straight to the physical. But the first hidden risk I see, the one that quietly erodes the well-being of countless men, isn't about your body at all. It's about your connection to the very world around you. Risk number 1, the slow drift into social isolation. I remember Robert, a retired history teacher, 67. Sharp mind, gentle demeanor. He sat across from me, not with a specific physical complaint, but with a quiet heaviness in his eyes. After some hesitant small talk, he leaned forward, his voice low. "Doc," he said, "I haven't held someone, truly held them, in months, but I still take care of things myself. Is that wrong?" That question lingered with me long after he left. Not because of the act itself. There's nothing inherently wrong with self-pleasure. In fact, when approached with intention and balance, it can be a healthy part of a man's life at any age. The profound danger lies in what happens when it subtly becomes a replacement for intimacy rather than a complement to it. Countless men in their 60s, 70s, and beyond find themselves drifting into quiet routines. That solo release offers comfort, a predictable spark in a day that might feel increasingly monotonous. It fills a void, a need for touch, for sensation, for a fleeting moment of feeling truly alive. Slowly, almost imperceptibly, without conscious decision, something shifts. The effort to reach out, to call a friend, to join a club, to risk the vulnerability of asking someone for coffee, let alone pursuing romantic connection, starts to feel like too much. Why navigate the complexities, the potential rejection, the awkwardness, when the private option is right there, safe, and instantly gratifying? Masturbation fills the gap until the gap becomes a canyon. It's not just about sex, it's about the painful withdrawal from life. From the warmth of a hug, the shared laughter over coffee, the simple comfort of eye contact that says, "I see you." From feeling like a vibrant man, not just a patient or a pensioner. I've witnessed men lose the very desire to date, to touch, to engage socially, simply because the solo path became the easier, less risky option. And here's the critical truth, backed by decades of research into human connection: physical touch is medicine. Studies consistently show it lowers stress hormones like cortisol, boosts feel-good hormones like oxytocin and serotonin, and even supports healthy immune function. It keeps your emotional circuits firing, your sense of self-worth anchored, and yes, it helps maintain a healthy hormonal environment, including testosterone engagement. When you stop reaching out, your world shrinks. Not because you're old, but because you've started to believe, perhaps unconsciously, that what you have to offer isn't wanted anymore. That canyon of isolation isn't inevitable. If you've noticed yourself turning inward more, if your private life feels like your primary source of connection, please hear this. It's not a failure. It's a signal, a reminder that you are fundamentally wired for connection. Reclaiming it doesn't demand leaping back into dating. It starts small. A phone call to an old friend, joining a walking group at the community center, striking up a conversation with the person next to you at the library. Intimacy isn't solely sexual. It's being seen, heard, and valued as a human being. The moment we stop believing we deserve that closeness is the moment we begin settling for isolation disguised as independence. Risk number 2, the unseen threat of skin microlesions. A few months back, George, a fit 71-year-old, came in looking embarrassed. "Doc," he mumbled, avoiding eye contact, "down there, after it gets irritated. Red, sometimes a bit sore. Lately, it's happening almost every time. What's wrong with me?" His shame was palpable, as if he thought this was something he should have outgrown. Here's the biological reality often overlooked: the skin of the penis changes significantly with age. It becomes thinner, loses elasticity and collagen, the protein that keeps skin plump and resilient, and produces less natural oil. Think of it like the skin on your hands or face. It simply doesn't bounce back like it used to. Combine this natural thinning with decades of friction, and it's a setup for trouble. During masturbation, especially if done vigorously or without adequate lubrication, the delicate penile skin can develop microlesions. These are tiny, often invisible tears or abrasions, like microscopic paper cuts. Initially, you might only notice mild redness, a slight stinging sensation afterward, or a bit of extra sensitivity for a few hours. Easy to dismiss, but here's the insidious part. Repeated microinjuries lead to chronic low-grade inflammation. This inflammation isn't just uncomfortable. It can actually decrease sensitivity over time, making it harder to feel pleasure. Worse, these tiny breaks in the skin barrier create entry points. The warm, moist environment is perfect for bacterial or fungal infections to take hold, leading to more significant irritation, itching, or even discharge. A study published in the Journal of Sexual Medicine highlighted that genital skin health is a critical, yet frequently ignored, factor in sexual well-being for older men. Many men, like George, misinterpret this discomfort as a sign of failing hormones or nerve damage, adding unnecessary anxiety. The truth is often much simpler. Your technique needs to evolve with your changing body. Masturbation shouldn't hurt. Discomfort isn't a sign you're broken. It's your body asking for gentler care. The solution is respectful adaptation. Gentleness is key. You're not 25. That's not a weakness. It's a reason to treat your body with more reverence, not less. Slow down, ease the pressure. Lubrication is non-negotiable. Ditch the spit or petroleum jelly, which can clog pores and cause further issues. Invest in a high-quality, water-based lubricant designed for sensitive skin. It drastically reduces friction, prevents tearing, and actually preserves sensitivity. Look for glycerin-free options if you're prone to irritation. Focus on sensation, not speed. This isn't a race. Slow down, explore different types of touch. Pleasure at this stage is about quality and connection with your own body, not just the endpoint. Shifting your approach isn't shameful. It's profoundly wise and self-respecting. You're learning to work with your body, honoring its journey. Risk number 3. The silent training of desensitization. Mark, 64, sharp, active, sat in my office looking defeated. "Doc," he confessed, "I can get there on my own, no problem. But with my wife, it's like I can't feel much. It takes forever, or sometimes nothing. I don't understand. What's wrong with me?" This scenario is heartbreakingly common, and it's rarely just about low T or circulation. Often, it's about neurological conditioning, what I call the quiet training of your nervous system. Here's how it works. When masturbation follows the exact same pattern every time, same grip strength, same rhythm, same speed, same fantasy or visual stimulus, especially intense pornography, your brain and body form a very specific pathway to arousal and orgasm. It's like pouring water down the same spot on dirt. Eventually, it carves a deep trench. Soon, water only flows down that trench. For your nervous system, it learns that only the specific, high-intensity, predictable stimulus leads to pleasure. Real-world intimacy, with its nuances, variations in touch, scent, emotional connection, and the natural ebb and flow of a partner, simply can't compete. The brain has been conditioned to expect the superhighway, the country road feels dull. This is desensitization. Studies on neuroplasticity, the brain's ability to rewire itself, confirm this. Repeated exposure to highly specific, intense stimuli strengthens certain neural pathways while others weaken. For men over 60, this often manifests as needing much more intense stimulation to get aroused with a partner, difficulty maintaining arousal during partnered sex, inability to climax unless replicating the exact solo conditions, e.g., specific grip, fantasy, a feeling of numbness or detachment during real intimacy. Mark wasn't broken. His arousal system had become overly specialized. The good news? Neuroplasticity works both ways. You can retrain your sensitivity. Rewiring for real connection. Variety is vital. Change your routine constantly. Use a lighter touch sometimes, a different grip other times. Vary speed and pressure dramatically. Explore different parts of your body. Engage your imagination. Reduce reliance on external, high-intensity visuals, porn. Use your own memories, fantasies built on real experiences, or focus purely on physical sensation. Slow way down. Make pleasure about the journey, not the destination. Spend time exploring sensation without the goal of orgasm. This builds sensitivity to subtler stimuli. Mindfulness, pay attention to the actual physical sensations, not just the mental fantasy. Feel the warmth, the texture, the subtle shifts. Your nervous system isn't broken, it's overtrained. With patience and conscious effort, you can rebuild sensitivity to the beautiful complexity of real human connection. Risk number 4, masking the warning signs of erectile dysfunction. James, a vibrant 68-year-old who still hiked regularly, delayed seeing me for nearly a year. When he finally came in, the worry was etched on his face. "Okay, doc," he admitted after some coaxing, "here's the thing. When I'm alone, I can get hard. Not like when I was 30, but enough. With my wife? Forget it. It just doesn't happen anymore. So, I've stopped trying. It's easier this way." James thought he had an intimacy problem. What he didn't realize was that his body was sending him a critical early warning signal, potentially for something much more serious. The penis is a barometer for your cardiovascular system. Erections require a complex symphony: healthy blood flow, flexible arteries, robust nerve function, balanced hormones, and psychological ease. When something starts to go awry systemically, early-stage cardiovascular disease, undiagnosed diabetes, high blood sugar damages blood vessels and nerves, declining testosterone, or neurological issues, erectile dysfunction, ED. With a partner is often the very first noticeable symptom. Masturbation, however, can often bypass these early issues. Why? Psychological ease, less performance anxiety, no partner pressure. Physical control, you control the exact stimulation needed. Familiarity. The brain and body are in a highly predictable, low-stress pattern. So, while you might still achieve erection solo, you could be completely masking underlying ED when it comes to partnered sex. This is dangerous because ED is frequently a canary in the coal mine for heart disease, stroke risk, diabetes, or hormonal imbalances. Ignoring it means ignoring potentially life-threatening conditions in their most treatable stages. A landmark study, the Massachusetts Male Aging Study, clearly established the link between ED and future cardiovascular events. Men with ED are significantly more likely to have a heart attack or stroke within 10 years. James wasn't just avoiding intimacy, he was avoiding a crucial health check. The ability to get erect solo doesn't mean everything is fine if partnered erections fail. That discrepancy is a red flag. The vital step: don't ignore the signal. If you notice a pattern, reliable erections alone but consistent difficulty with a partner, see your doctor or a urologist. Get checked: cardiovascular health, blood pressure, cholesterol, blood sugar, HbA1c test. Hormones, testosterone levels, total and free thyroid function. Neurological health, basic checks for nerve function. Medication review, many common meds, blood pressure, antidepressants can contribute. Treating the underlying cause, improving blood sugar control, managing blood pressure, testosterone replacement if appropriate, can often restore erectile function and, more importantly, protect your overall health. Masking the issue with solo habits only delays potentially life-saving interventions. Your erections are telling you something. Listen to them. Risk number 5, nerve compression. The posture problem. Arthur, 72, came in complaining of a persistent, dull numbness in his groin area. "It's not painful, doc," he described, "just absent. Like the feeling is muffled. Started about 6 months ago, just getting worse." He feared nerve damage or circulation problems. After a thorough exam, the culprit turned out to be surprisingly mundane: how he was sitting, particularly during his private time. Many older men spend significant time seated, in recliners, at desks, or quietly in their favorite chair. During masturbation, this often happens in a seated or hunched position. What most don't realize is that poor posture, especially sitting on hard surfaces or slouching forward, puts direct pressure on a critical nerve, the pudendal nerve. This nerve is responsible for sensation in the penis, perineum, the area between scrotum and anus, and surrounding pelvic floor. It's the main sensory and motor nerve for your genital region. Prolonged or repeated pressure on this nerve, from sitting on hard chairs, cycling, or even prolonged slouching, can cause pudendal nerve compression or irritation. Symptoms include numbness or reduced sensation in the penis/scrotum/perineum, tingling or pins and needles, aching or burning pain in the pelvic region, difficulty achieving or maintaining an erection due to impaired nerve signals, pain during or after ejaculation. This often starts subtly: a slight decrease in sensitivity, an unusual buzzing feeling. Ignored, it can become chronic and significantly impact sexual function and comfort. A study in neurology and urodynamics emphasized the role of posture and prolonged sitting in pudendal neuralgia, nerve pain. Protecting your nerve pathways. Change your position. Avoid masturbating while sitting upright on hard chairs or slouching. Opt for lying on your back or side. If sitting is preferred, use a well-cushioned seat and ensure good lumbar support. Reclining slightly can help. Use support. Placing a pillow under your knees if lying on your back, or under your hips if on your side, can help align the pelvis and reduce pressure. Take movement breaks. Get up and move around every 30 to 60 minutes if you sit a lot during the day. Gentle stretching helps blood flow and relieves nerve pressure. Be mindful of pressure. Pay attention to any numbness or tingling during or after. It's a sign to adjust immediately. Your nerve health is foundational to sexual sensation and function. Protecting it through mindful posture is a simple yet powerful act of self-care. Comfort isn't indulgence, it's preservation. Risk number 6, when pleasure becomes your only escape. "I just get so tired of the quiet, doc," Michael, 69, said softly, looking out the window. "The days are long since Helen passed. The news is grim. Sometimes, I just need to shut it all off. You know, it helps for a little while." Michael wasn't describing lust, he was describing using masturbation as his primary emotional escape hatch. Self-pleasure does provide temporary relief. It triggers a cascade of neurochemicals: dopamine, the reward chemical, creating a sense of pleasure and motivation; oxytocin, the bonding or cuddle hormone, promoting feelings of calm and safety; prolactin, induces relaxation and satiety after orgasm; lowered cortisol, the primary stress hormone. This chemical cocktail offers a legitimate, albeit brief, respite from stress, loneliness, boredom, grief, or anxiety. For men navigating retirement, loss, or isolation, it can become a powerful, easily accessible coping mechanism. The danger arises when it becomes the only or primary coping mechanism. Instead of processing difficult emotions, the sadness of loss, the frustration of changing roles, the anxiety about health or finances, masturbation becomes a way to numb them, to hit the off switch momentarily. Over time, this reliance can turn into a form of avoidance. You might skip social invitations, "I'm tired," avoid calling friends, or lose interest in hobbies you once enjoyed, simply because the easier, more predictable comfort of the solo act is readily available. A study on coping mechanisms in older adults published in Psychology and Aging found that over-reliance on avoidant coping, like using substances or behaviors to escape, is linked to higher rates of depression and lower life satisfaction. Expanding your emotional toolkit, acknowledge the feeling before reaching for physical release, pause. Ask, what am I really feeling right now? Lonely? Stressed? Sad? Bored? Naming it is the first step. Seek connection, non-sexual, call a friend, join a men's group, volunteer. Human connection is a powerful antidote to loneliness. Physical movement, walk, garden, swim. Exercise is a proven stress buster and mood enhancer. Mindfulness/meditation. Learn to sit with discomfort without immediately needing to escape it. Apps or local classes can help. Professional support. Talking to a therapist, especially one experienced with older adults, provides healthy outlets and strategies. Masturbation can be part of self-care, but it shouldn't be your only emotional outlet. Building a range of coping skills protects your mental and emotional well-being far more effectively. You deserve more than momentary relief. You deserve lasting resilience. Risk number 7, the heavy burden of guilt and shame. Samuel, 72, a retired minister, was one of the kindest souls I've met. When our conversation turned to sexual health, his eyes filled with profound sadness. Dr. Lee, he whispered, I know it's natural, they say, but sometimes afterward, I feel so ashamed. Like I failed God, failed myself. I can't even pray properly. Samuel's pain wasn't physical, it was the deep, enduring weight of internalized guilt and shame. For many men of older generations, particularly those raised in strict religious or highly traditional environments, masturbation was often framed not as a normal biological function, but as sinful, weak, dirty, or perverse. These messages, ingrained during formative years, create powerful neural pathways associated with guilt. Decades later, even if intellectually they understand it's natural, the emotional and physiological reaction remains. Every act of self-pleasure can trigger a cascade of shame, feelings of worthlessness, moral failure, self-disgust. This isn't just feeling a bit bad, it's a deep wound to the sense of self. The impact of chronic shame is profound and physiological. Elevated stress hormones. Persistent shame keeps cortisol levels high, contributing to inflammation, weakened immunity, anxiety, and depression. Nervous system dysregulation. It can put you in a constant state of low-grade fight or flight, disrupting sleep, digestion, and overall well-being. Diminished capacity for pleasure. The brain associates sexual activity with punishment, making it harder to experience genuine enjoyment or arousal. It creates a vicious cycle. Erosion of confidence affects all areas of life, making social interaction and intimacy harder. Samuel wasn't experiencing physical harm from the act. He was experiencing real harm from the crushing guilt he attached to it. Research on the psychophysiology of shame confirms its detrimental effects on mental and physical health. Healing the shame. Separate fact from feeling. Understand that the shame is a learned response, not a reflection of reality. Biologically, masturbation is a normal human behavior. Challenge the internal voice. When shame arises, consciously counter it. This is a natural part of being human. I am not dirty or weak for experiencing this need. Seek reframing. Talk to a progressive spiritual leader, therapist, especially one specializing in sex therapy or religious trauma. Or read books offering healthier, more compassionate perspectives on sexuality and aging. Practice self-compassion. Treat yourself with the kindness you would offer a dear friend. Acknowledge the difficulty and offer understanding. Focus on health. Frame self-pleasure as part of caring for your physical and emotional well-being, not a moral failing. Releasing this burden of shame isn't just about sexual health. It's about reclaiming your whole self-worth and peace of mind. You are not defined by an outdated message. You deserve to inhabit your body without judgment. Risk number 8. Pelvic congestion. The ache of overuse. Frank, 69, recently retired, described a persistent, dull ache. It's not sharp, document, just a heavy feeling low down. Like I've been sitting on a bike too long, but I haven't. His prostate was healthy, no infection. When discussing habits, Frank admitted retirement had left him with long, empty hours. I find myself doing it more. Helps pass the time, helps me sleep. Sometimes 2-3 times a day. But lately, this ache just won't quit. Frank was experiencing pelvic congestion. Ejaculation involves complex muscular contractions and significant blood flow to the pelvic region. While healthy in moderation, excessive frequency, especially multiple times daily over an extended period, doesn't allow the pelvic tissues adequate time to recover. Think of it like overexercising a muscle without rest days. For men over 60, whose tissues are naturally less elastic and whose circulatory systems may not be as robust, this is particularly impactful. Pelvic congestion refers to a buildup of blood and pressure in the veins and tissues of the pelvis due to repeated, frequent engorgement and release without sufficient downtime. Symptoms include a persistent, dull ache or heaviness in the testicles, perineum, or lower abdomen, a sense of fullness or pressure in the pelvic area, discomfort or soreness after ejaculation that lingers, sometimes urinary frequency or a sense of incomplete bladder emptying due to pressure. This congestion causes low-grade inflammation and can make the entire pelvic region feel fatigued and uncomfortable. Frank wasn't wrong for seeking pleasure. His body simply needed more recovery time than it did decades ago. Studies on pelvic pain syndromes in men often note that overuse of the pelvic muscles and vascular structures is a contributing factor. Finding your rhythm. Listen to your body. Pay attention to any ache, heaviness, or fatigue in the pelvic area after ejaculation. This is your signal. Embrace moderation. Most men over 60 find their bodies function best with several days between ejaculations. This isn't a rigid rule, but a guideline for recovery. Experiment to find your comfortable rhythm. Quality over quantity. Focus on the depth and enjoyment of the experience, not the frequency. A single, mindful session is often far more satisfying than multiple rushed ones. Warm baths can help soothe pelvic muscles and improve circulation if congestion occurs. Gentle movement, walking or light stretching can help move stagnant blood. More isn't necessarily better. Giving your pelvic tissues time to rest and reset reduces inflammation, relieves discomfort, and often makes the pleasurable sensations stronger when they do occur. Respect your body's need for recovery. Risk number 9, the quiet impact on semen quality. If fatherhood is a goal, Ben, 61, newly married to a younger woman, radiated hopeful excitement. "We're trying for a baby, Doc," he said. "It's early days, but 6 months in, nothing yet. Everything seems okay, but..." Ben was healthy, active. His hormone levels were reasonable for his age. Then we discussed frequency, pretty much daily, Ben admitted. "Helps me relax." Figured, practice makes perfect, right? This is a common, understandable belief. However, when it comes to fertility, especially for men over 60 where natural sperm production, spermatogenesis, is already slowing down, frequency matters significantly. Frequent ejaculation temporarily reduces semen volume and sperm concentration. Each ejaculation depletes the stored sperm in the epididymis, the tube where sperm mature. While the body constantly produces new sperm, it needs time to replenish the reservoir to optimal levels. For older men, this replenishment process is inherently slower than in younger men. Ejaculating daily or multiple times daily means you're often ejaculating sperm that haven't had sufficient time to mature and build up in concentration. Research, including guidelines from the American Society for Reproductive Medicine, consistently shows that abstinence periods of 2 to 5 days before attempting conception yield the highest sperm concentration and motility movement. Sperm morphology, shape may also improve slightly with a short abstinence period. Optimizing your chances. Timing is strategic. If you and your partner are actively trying to conceive, plan ejaculations. Aim for a 2 to 5 day abstinence period before your partner's most fertile window. Moderate frequency. During non-fertile times, moderate your frequency, e.g., every 3 to 4 days, to allow for better overall sperm reservoir maintenance. Focus on health. Support sperm health with a balanced diet rich in antioxidants, fruits, vegetables, zinc, healthy fats, and folate. Avoid excessive heat, hot tubs, saunas, smoking, and excessive alcohol. Consult a specialist if conception doesn't occur after 6 to 12 months of well-timed attempts. Depending on partner's age, see a reproductive urologist or fertility specialist for both partners. Semen analysis is key. While this risk applies specifically to men pursuing fatherhood later in life, it underscores a vital point: understanding how your body functions now is crucial. Intentionality, not just frequency, matters when you have a specific goal. Your capacity for creation is still present, it just benefits from wise strategy. Risk number 10, disconnection from reality, the fantasy trap. "I miss the real thing, Doc," confessed Leonard, 73, with a surprising candor. "But honestly, real life just doesn't measure up anymore. It feels slow, complicated. What gets me going is, well, what's on the screen. It's immediate, intense. Real intimacy feels bland in comparison. When did that happen? Leonard was describing a profound disconnection from reality fueled by the overuse of intense fantasy, particularly pornography. The male brain is highly responsive to novelty and intense visual stimulation. Modern, easily accessible pornography often provides supernormal stimuli, exaggerated, hyper-intense scenarios that don't reflect real human intimacy. Repeated exposure to this rewires the brain's reward system. Dopamine surges become tied to these artificial high-octane inputs. Gradually, the brain starts to require this level of intensity to feel the same level of arousal. Real-world intimacy, with its slower build-up, emotional nuances, subtle cues, natural sense, and the beautiful imperfections of a human partner simply cannot compete neurologically. It feels underwhelming, even boring. For older men experiencing loneliness or less frequent partnered sex, the lure of this intense, predictable, solitary stimulation can be powerful. However, the cost is high. Diminished arousal with partners, difficulty getting or staying aroused during real sex, unrealistic expectations, subconscious or conscious comparisons of partners to impossible standards, emotional detachment, difficulty connecting emotionally during intimacy, loss of desire for real connection. The effort seems too great for the perceived lesser reward. Leonard wasn't experiencing ED in the classic sense, he was experiencing a neurological preference shift toward the artificial over the authentic. Studies on the effects of pornography consumption highlight its potential to alter sexual tastes, expectations, and arousal patterns, sometimes leading to sexual dysfunction with partners. Reconnecting with the real, take a break, commit to a period, e.g., 30 to 90 days. Without pornography, allow your brain's arousal pathways to reset. Rediscover sensation and imagination. Focus on physical touch, memories of past real intimacy, or purely sensation-based fantasies during self-pleasure. Mindful masturbation. Slow down. Focus entirely on the physical feelings in your body, not external visuals. Prioritize real connection. If partnered, focus on sensual touch, kissing, communication. Rebuild the neural pathways for partnered pleasure without immediate pressure for intercourse or orgasm. Patience is key, rewiring takes time. Be patient and compassionate with yourself. The richness, vulnerability, and depth of real human connection offer a satisfaction that fantasy cannot replicate. Reclaiming sensitivity to that authentic intimacy is possible and deeply rewarding. Conclusion. Turning awareness into empowered action. So, we've journeyed through these 10 hidden risks, from the quiet erosion of social connection and the unseen microtears on delicate skin, to the neurological conditioning of desensitization and the dangerous masking of underlying health issues. We've explored the impact of posture on vital nerves, the emotional trap of using pleasure as the sole escape, the heavy burden of shame, the physical ache of pelvic congestion, the subtle impact on fertility potential, and the profound disconnection caused by the fantasy trap. The message isn't that masturbation is bad for men over 60. Far from it. The message is that how you engage in this private act matters profoundly to your overall health, well-being, and capacity for intimacy. It's a tool. Used with awareness, gentleness, variety, and balance, it can be a source of comfort, stress relief, prostate health support. Studies suggest regular ejaculation may reduce prostate cancer risk and even improved sleep. Used unconsciously, habitually, or in ways that ignore your body's changing needs, it can become a source of silent harm. This stage of life demands a shift, not away from pleasure, but towards wiser pleasure. Pleasure that respects your body's wisdom, honors your need for connection, and supports your vitality. It demands listening to those subtle signals. The ache, the numbness, the guilt, the creeping isolation, the fading sensitivity. These aren't signs to give up. They're invitations to adapt, to care for yourself more deeply. The path forward: embrace gentleness with your body, your expectations, your self-judgment. Prioritize lubrication. Protect your delicate skin. Vary your approach. Break the neural ruts, rediscover sensitivity. Listen to erection signals. Don't ignore discrepancies. Seek medical insight. Mind your posture. Protect your pudendal nerve. Expand your coping toolkit. Don't let solo pleasure be your only escape. Challenge shame. Seek understanding and self-compassion. Respect recovery time. Avoid pelvic congestion. Be strategic if conceiving. Understand sperm replenishment. Choose reality over fantasy. Reclaim authentic connection. And now, as promised, let's talk about that simple, natural 7-second technique. It's based on a foundational principle of pelvic health, strengthening the bulbocavernosus muscle, BC muscle. This muscle wraps around the base of the penis and plays a crucial role in erectile rigidity and blood flow. Strengthening it can enhance firmness and control. The 7-second BC muscle pulse. Identify the muscle. The next time you urinate, try to stop the flow midstream. The muscle you squeeze to do this is your BC muscle. Note, only do this identification once or twice. Don't regularly stop urination. The exercise throughout the day, sitting, standing, lying down, anytime, consciously contract your BC muscle. Squeeze it firmly for 7 seconds. Imagine pulling the base of your penis slightly inward and upward. Breathe normally. Don't hold your breath or tense your abdomen, buttocks, or thighs. Relax, release completely for 7 seconds. Repetition. Aim for 10 repetitions, 3 to 4 times per day, e.g., morning, lunchtime, afternoon, evening. Consistency is key. Why it works? Regular BC muscle contractions improve blood flow to the penis, enhance the pumping action that maintains erections, and can improve the sensation of firmness. It's safe, natural, requires no equipment, and takes mere seconds. Many of my patients report noticeable improvements in erectile quality and control within 4 to 6 weeks of consistent practice. Knowledge is power, but action is transformation. Start applying these insights today. Be gentle with yourself. Listen to your body. Reclaim the vitality, connection, and confidence that are your birthright at any age. Before you go, if this deep dive into your health resonated with you, please consider subscribing. We create content like this specifically for men navigating their 60s, 70s, and beyond, because this information is vital and often overlooked. Tap that subscribe button and the notification bell so you never miss an update. Did this video speak to you? Let me know by typing 1 in the comments. If it didn't, type 0. Your input directly shapes what we create next. Stay strong, stay informed, and honor the wisdom of your body. I'm Dr. David Lee. Take care.